for you. This is a CBS 6 breaking news alert.
Good afternoon. I'm Cheryl Miller. We're interrupting your CBS 6 programming to bring you breaking news from the state capitol grounds in downtown Richmond. Governor Northam providing an update on Virginia's response to the COVID-19. Here is the governor.
With us today, I want to update you on next steps under our executive orders dealing with businesses and public gatherings, as well as new help for workers who need child care. All of this starts with data. As you saw in Monday's modeling data, social distancing is working. We saw that in the model UVA released on Monday and in other national models. The actions that we have taken as a state are having an effect. They are slowing the spread and flattening the curve. We're still seeing new cases, of course, and unfortunately, too many deaths. But in large part, these are still cases that were contracted weeks ago. So when people say that it's time to stop what we're doing and get back to normal, they're wrong. Right now, the models and our hospitals expect that we'll be able to handle the expected surge in patients. But if we let off the brakes and try to go back to the way things were, we'll see another spike in cases that could overwhelm our hospitals. You saw that as well in Monday's data. That's why today I'm extending Executive Order 53 for 2 more weeks. I issued that order on March the 24th. It's the order that closed recreation and entertainment businesses as well as personal care services. It also banned gatherings of more than 10 people. It is set to expire next week. Now it will expire on May the 8th. We will continue to monitor health data in the meantime to determine what needs to happen after that. It's important to remember that the stay-at-home order remains in effect until June the 10th. I know that everyone is looking forward for a path forward. I am talking regularly with our neighbors in Maryland, the District of Columbia, and North Carolina. We want to move forward in a coordinated way. We all want what is best for the health and safety of our people. I know this has been a frustrating time for all of us. People are out of work. Businesses are closed. Our entire sense of normal life is out the window. People want to go out. They want to work or to see their friends and families. They want to know when they can regain control of their lives as they once knew them. And everyone needs to remember that a lot of people are working overtime, taking care of patients, or stocking grocery shelves. They're stressed. They feel like their health is at risk, and they want to protect their families. I hear you. We're all in this together. I want everyone to know these sacrifices that you have made have been necessary, and they are helping. They are slowing the spread. They are giving us time to plan and prepare. We need to be clear. Things are not going back exactly like they were before. Together, we will figure out how to build a new normal. Right now, that new normal will probably look like covering your face, spending more time at home, teleworking if you can, continuing to use social distancing, and to stay away from large gatherings. We all will continue to weigh what we want versus what we need. We will figure out how to continue taking steps to protect ourselves and people who are most vulnerable, those that are elderly and those that have previous health conditions. Then we can move to easing the restrictions. As Dr. Fauci has said, there is not a switch that we can flip. The way forward will be deliberate and it will be careful. But we will move forward and we will do this together. Our business community will be a part of this conversation. They have been so helpful, working with our economic strike force and looking at creative ways to make sure that when we do ease restrictions, consumers like you will be able to feel safe and comfortable returning to businesses. Remember, Virginia started off strong before this virus, and we will continue to be strong moving forward. This is a great state in which to do business, and new laws make this an even better place to work. Prior to COVID-19, our economy was literally on fire. Our March general fund revenues were 10.8% higher than last year. Think of that. 10.8% higher this March than they were a year ago. But that has changed, unfortunately, and we must work together to rebound. Now let's turn to another way we are helping our essential workers. The closure of our K-12 schools affects some 1.2 million Virginia children under age 12. With social distancing requirements, many child care centers have closed their doors. But child care remains vital, especially for essential workers, hospital staff, law enforcement, sanitation workers, postal workers, UPS and delivery drivers, grocery workers, corrections officers, and many others who are still working to keep our society moving forward. Today, I'm pleased to announce that $70 million from the CARES Act will go to support these essential workers with children under age 12 and the hardworking early childhood educators. This money will allow us to do the following things. We will provide direct, flexible cash assistance to the centers that have remained open. We will prepare schools to act as emergency child care centers where needed. We will eliminate co-payments until June for families who are already receiving federal child care subsidy dollars. And we will make additional funding available to centers that accept federal subsidy dollars but had to close. We want to be sure that centers that serve our most vulnerable Virginians are ready to welcome children back when it is possible to do so. These measures should help some of our child care centers stay open to serve the children of our essential workers. My wife, Pam, a former teacher and pediatric occupational therapist, has dedicated the past 2 years to advocating for Virginia's early childhood system. She has additional information to share for our providers and families. Because of her team's efforts, we were on target to ensure that all at-risk 3- and 4-year-olds had access to early childhood education in our Commonwealth. And then COVID-19 arrived. But I want to reassure you that as we recover, early childhood education will continue to be a top priority of ours. So Pam, to you and your staff, I thank you so much for all of your work for our children, and welcome.
Thank you. Good afternoon. As the governor said, over the past 2 years, I've traveled over 5,000 miles visiting early childhood educators and families across the Commonwealth to highlight the critical importance of those first few years of life. It has been abundantly clear that the most important part of Virginia's early learning system is our talented superhero educators, and these past few weeks have made that more evident than ever. I know these are challenging and unprecedented times, which is why we fought so hard to get this additional $70 million to you as quickly as possible. Providers, please visit childcareva.com for more information on these new resources. We also ask that all providers share their most up-to-date hours and availability with Child Care Aware of Virginia at 866-KIDS-TLC or virginiachildcare.org. Parents, you are a child's first and most important teacher. You know your children best, And we know you are courageously and tirelessly working to support and reassure your children during this time, even when you may be feeling overwhelmed yourself. We thank you for the sacrifices you are making to keep your family and your community safe. If you need childcare because you have to work, whether as a healthcare worker, first responder, or in other essential industries such as food and grocery, sanitation and cleaning, transportation, utilities, or government, please know that we are so grateful to you and invite you to also visit Childcare Aware at vachildcare.org or call 1-866-KIDS-TLC for an up-to-date list of where you can get quality childcare in your area. Thank you for everything you do to give us hope each day. The Commonwealth is strong, our children are resilient, and together we will get through this. Together we will continue to work to lead the nation in early childhood care and education, the cornerstone to building a better, brighter future for our young people and our nation. Thank you so much.
While we are focused on the COVID outbreak, we also cannot forget that tomorrow, April the 16th, is the anniversary of the tragic mass shooting at Virginia Tech in 2007. I have ordered all flags across the state to be lowered to half-staff in memory of the 32 people who were killed that day. Our thoughts are always with their families and loved ones. Now I'll ask our Health Commissioner, Dr. Norm Oliver, to give you a health update, and then we'll be glad to take your questions. Dr. Oliver, welcome.
Thank you, Governor. Good afternoon. The numbers today for the impact of this pandemic here in the Commonwealth. We now have a total number of cases of 6,500. That's 329 new cases in the last 24-hour period. The deaths now total 195. That's an increase of 41. Just a word on that, that's a big jump from the last time it was reported. And I think it's important to understand that disease surveillance, including death surveillance, is not done in real time. It involves several steps, and at each of those steps, human beings are involved. We don't know about someone's death in the moment that it happens. In small outbreaks, that means that we can catch up pretty quickly. In the situation of a pandemic, it takes longer time, and that gets reflected in this lag in numbers and in periodic jumps in those numbers in our dashboard. The Health Department has an obligation to ensure that you get high-quality, accurate data in as timely a fashion as is possible. But it's important that we vet that data and make sure that it's really high quality and accurate. So we would like to thank you all for your patience and your support as we carry out this important work, and also thank you for communicating this information to the public. The data that we have on the racial and ethnic categories and the cases and deaths continues to have problems with some missing data. Of the 6,500 cases, we only have 3,904 that have the data on race and ethnicity. Given that, the 1,158 cases of COVID-19 among African Americans means that that population in our state has 30% of the cases. In terms of deaths, with 59 deaths among African Americans, and with the race and ethnicity data available on 168 of our total of 195, that means 35% of the deaths are African American. Thank you.